And we're back, and I gotta tell you, time is flying by, and Dr. Hannah is here, and you're gonna have to come back because there's no way we're gonna be able to finish everything we want to talk about in today's conversation.
Yes.
You betcha. So let's now, as an endocrinologist, I can't have you sitting next to me and not talk about hormones and the role that it plays in so many aspects of our health. So let's start sort of biting this elephant a little bit at a time. Let's talk about hormones, for example, and the role they play in brain health and mental health. We know that we've got a real crisis right now. Let's talk from the perspective of an endocrinologist, the role that hormones are playing in that respect.
Yeah, so hormones are signals produced by various cells in the body. Some of these cells belong to endocrine glands, namely thyroid gland, pituitary gland that sits behind the eye in the brain, adrenal glands, and the gonads. And they are produced throughout our lifespan. They determine our sex in utero. They play an important role during puberty and during development of disease. So I think it's very important to understand that there's so much that we don't know about these important signaling molecules. And I'll give you an example. The body produces over 300,000 different peptides. Peptides are small amino acid chains. The FDA recognizes peptides as amino acids of less than 40. More than 40, they're labeled as proteins. And we don't know what most of these peptides do in the body. Same thing for a lot of our hormones. While we have sort of a general understanding of who they are and how they play an important role in our body's physiology, metabolism, cardiometabolic health, there's still a lot of unknowns in this field. So what can you do to ensure that your hormonal system is intact? Well, make sure that you get your hormones checked. More frequently, if you develop certain signs and symptoms that may be suggestive of a particular disease. Let's take thyroid disease as an example. 4 to 5% of the population have hypothyroidism or a low thyroid state. Some of the common signs and symptoms of a low hypothyroid state or hypothyroidism, with the most common cause being Hashimoto's thyroiditis, an autoimmune disease, constipation, poor sleep, hypersomnia or excessive sleep, dry skin, hair loss, difficulty concentrating, weight gain. And oftentimes, a lot of hormonal problems present with non-specific symptoms. Weight fluctuation, mood swings, mental health-related signs and symptoms that may be mistaken for a primary psychiatric condition, menstrual irregularities, skin changes, hair changes. So, a lot of the sort of common signs and symptoms that we hear our patients talk about can arise from a hormonal imbalance. It's easy today to check for hormonal imbalances through blood work. And there are some innovative companies that are developing at-home salivary-based hormone testing products as sort of consumer products that will allow for early, rapid, preemptive screening. Once a diagnosis is established, then the underlying condition is treated either with hormone replacement therapy or hormone suppression with or without surgical intervention in the event of a tumor. I think that we need to be very proactive about hormone screening and hormone management. Oftentimes, hormone-related conditions go unnoticed for many years.
Yes, indeed.
They may be mistaken for other conditions. We oftentimes see misdiagnosis or overdiagnosis because we heavily rely on laboratory values to diagnose a lot of these hormone imbalances. And there are pitfalls that are laboratory because of the limitations of the lab that may give us sort of a false positive screen of a hormone condition. So make sure that you discuss all of these with your doctors, get screened, and hopefully, you will not fall into the category of a false positive test. But we're happy to help. Seek care from an endocrinologist or a healthcare provider that specializes in hormone health because they're very prevalent.
Yes. And, for somebody like me who had a very severe case of endometriosis and went misdiagnosed for years. It was Dr. Christy Prouse, an OBGYN and the founder of the Institute for Hormonal Health, that truly turned my life around years and years later with hormone replacement, and we did a 3-part hormonal health series. But sitting across from you as an endocrinologist and saying there are a lot of physicians, though, when the menopause conversation, for example, right now in the media, everybody's talking about menopause and perimenopause, and it can be a challenge to find a physician that truly understands hormonal health to the level that can be truly helpful. But please tell us a little bit more about some of these options that people have to go find themselves, like organizations that you're working with that maybe their physician won't know. And how do they have that conversation with their physician when they do go get a test that maybe their physician doesn't know about?
Right. So I'm a big advocate for technological advancement, using innovation in the field of healthcare to create that bridge between traditional healthcare models and sort of the newer medicine 3.0 models, and more importantly, to help scale traditional healthcare services through technology.
Right.
So I'm a medical advisor for Science and Humans, which is Canada's largest digital health platform for hormone health, including menopause care. And they've built an incredible vertically integrated technology stack to service the menopause, thyroid, hair, sexual dysfunction related problems through their technology stack. And they service over 25,000 clients across Canada. And I'm very proud of what they've built because they are using innovation to help scale evidence-based services for very common conditions that typically have a long wait list to see a practitioner in the traditional healthcare model. So using digital health disruptive tools can help us in bridging that gap. In terms of menopause care, I'm so happy to see so many different initiatives, celebrities, voices that are shedding light on this important issue.
Me too.
Now, Mark, if a female is going to live to 100 in this era of proactive, longevity, health span focused care, don't they want to live the other 50 years with enough hormones?
Dr. Hannah, I'm just getting started. I'm 57 and went through menopause at 39, and you're absolutely right. But that has not been the way that's been presented to us. That has not been the options we've been given, hence why the work I've been doing for 30 years. So yes, we do want to live the last 50 years healthy and vital.
Absolutely.
Yes.
And this is a perfect example of some of the limitations of the traditional care models and or the research models that are out there today. So the scare comes from the women health initiatives that were not powered and or did not have the right methodology to reach the conclusions that they've reached. And that caused a scare for hormone replacement therapy amongst various specialists. And we're still seeing resistance amongst various healthcare providers in using hormone replacement therapy, particularly in the context of perimenopause, menopause, and postmenopause.
Yes.
Well, I can assure you that, we are seeing trends in acceptance, digital health innovation to provide females that are struggling through their perimenopause to menopause with access to hormone replacement therapy, and a general acceptance that it is a condition that needs to be treated because it does impact quality of life.
Absolutely.
Right? And overall prognosis, and it will change the course of chronic diseases that are at heightened risk for a female going through menopause and the postmenopause period.
Absolutely. And one of those risks is in the musculoskeletal system and osteoporosis prevention and management. And, I'm passionate about, as I've introduced to you, the new OsteoSound REMS bone scan, that technology, and looking at bone quality and bone mineral density and having access to this type of technology earlier so that we can get women into action. And hormone replacement and having an impact on musculoskeletal health is critically important.
Absolutely.
I feel the difference personally, but you're right, there is a lot of fear. And in the bone scan clinics we're doing, Megan and I, with OsteoSound, we're having a lot of these discussions and I'm telling them my story. No, I'm not a physician, but I am connected to and aware of all of the things that you're talking about. So I think it's these conversations are important, and thank you for raising that, because there is a lot of fear and there's still some resistance in the medical community, but it is changing. And I think if we can empower people to have the voices to speak to their physicians in this way, these types of podcasts are going to make a difference.
It's so vital.
It's so vital.
And we need to take that responsibility, right, to summarize the good data on such important platforms, so more and more individuals can seek evidence-based care and benefit from such interventions. I mean, we just talked about, the loss of power, fitness, increased risk for chronic diseases, and that has an impact on health span.
Yes.
So don't you want to empower the human body, the female body, with the right tools, particularly post-menopause, including hormone replacement therapy, to lower the risks of decline and disability and development of chronic disease? So I would double down not only on HRT and exercise and sleep, but on any other evidence-based tools that are out there today that can help promote healthy longevity, because we want to live a healthier, longer life, but not without the raw material that our body needs.
Indeed. So let's talk now a little bit about, in your bio, I talked about the fact that you're doing work with real estate and healthy homes. The definition of a healthy home to you is certainly probably not what the average listener or viewer is thinking a healthy home is to them. Let's talk a little bit about the role that tech and health tech can play in our healthcare system and in changing the quality of life of the average North American that's going to be listening to this.
It's such an important topic. So Healthspan Digital is a technology company that we built to solve the problem of scaling longevity services to the consumer. We built software. We license and distribute third-party software. We build longevity clinics and services and provide turnkey hub solutions to gyms and real estate developers and wellness centers. And we are closely working with real estate developers to providing them with smart technologies, focusing on proactive health management and screening, including smart mirrors that with a 30-second face scan can tell you about your vital signs, your mood, and give you access to a marketplace of products and services, and create a bridge through client-facing apps, command centers, and connectivity with healthcare services. Innovative, proactive, or traditional healthcare services. We see a huge opportunity in the home being healthy, devoid of toxins, with smart water and air quality solutions, and bringing in hospital, clinic, and various other healthcare related services to someone's environment so they could enjoy living in their environment. And the reality is people are spending more and more time at home. So don't you want to empower them with the right tools and services so they live in a healthy environment? We also see an opportunity to collect data, analyze data, and provide personalized insights and recommendations from the various products and services that we could deploy not only in the home, but across real estate community. Because at the end of the day, today real estate developers, through a very competitive landscape, want to build the best and finest real estate asset for their consumers. They want their consumers and their tenants to live in a healthy environment, right? To live in a pollution-free environment, and to provide them with the right healthcare services that, in the event of an emergency, they can achieve better outcomes. And so we're here to help provide those products and services, and we're launching the Smart Mirror technology next month in partnership with AI Nexus Healthcare, which is an American company that uses very advanced and proprietary computer vision, LLM, and cognitive AI models for health assessments. And we are very excited to scale this globally so we can empower our consumers with cutting-edge technology in this space.
Oh my goodness. Many years ago, I had a conversation about a smart mirror, and I can't think of the gentleman's name at the time. I'm going to connect. We'll chat about that offline. But one of the things that comes to mind right away are our senior population, the aging population, and then the children, the grown children that are caring for this aging population. It is such a relief at the thought of knowing that your senior, your elderly parent, for example, could be living longer in their home, in the environment that they want to live in, but with the support through biotech that we can be sending information and providing information to a healthcare team for that senior, because what if you don't live close to your parent and you can't be there? What if, so there's so many ways with the strains on our healthcare system with housing seniors and as people are declining with their health because we haven't got a hold of that chronic disease thing yet, like we've been talking about.
Right.
What a game changer that can be. And from the lens of a daughter with an aging mother, to know that there's opportunity to have that in a home, so it's going to give me some peace of mind for the safety and well-being
Yes.
of my loved one.
Yeah.
Like that in and of itself
Yep.
is invaluable.
Absolutely. So many use cases,
Yes.
right? Remote patient monitoring, telehealth services, marketplace, delivering products and services to your home, sensors for data gathering, the research and development that can go into understanding population behavior to build smarter and healthier cities,
Yes.
right? And so we want to empower consumers with these technologies. We also want to build technology that will provide privacy and confidentiality.
That's important.
Right? But the core of these initiatives is to really create healthier environments so we could live a longer, healthier life.
I'm really excited. We're running out of time here, but we will have you back. I know we discussed some of these health hubs. Now, as an owner of an award-winning clinic for 30 years and doing work in pop-ups, REM bone scan clinics that we're doing all over the country now, tell everybody a little bit about these health hubs, because any of those practitioners out there that are listening and have those wellness clinics, let's talk about what are some of those therapies that you're doing in these pop-up health hubs that you're offering, because this is how, over time, we change and disrupt the current way we deal with healthcare. And I love this. So I wanted you to touch on that for a moment.
We've developed Healthspan Hubs as an easy, cost-effective, turnkey solution, repurposing any 3x3 meter space into a revenue-generating opportunity for any wellness, clinic, hospital, hospitality, hotel, and gyms, using in-clinic equipments, a software layer for analytics, and a full tech architecture that connects consumers with the asset of interest, so they can provide evidence-based, personalized testing and insights to enhance their overall offering.
Right.
And in the field of healthy longevity, what makes it stands out compared to other subspecialties of medicine is the focus on biomarkers of aging, including biological ages.
Right.
And we're seeing a lot of interesting products and services being incorporated into our proactive healthcare models today that can, in a turnkey solution, enhance a physician or a fitness gym offering. And so we work as a project management health tech company with businesses to help them introduce such innovative, proactive healthcare products in a cost-effective way. And we're happy to work with anyone that's interested in implementing these. You can find us at healthspan.digital, where we outline the entire model.
Mm-hmm. And of course, some of those therapies, I mean, I'm so excited and honored that we're in discussion about how do we include REMS bone scans in those hubs, because I think that's critically important. But you also do other types of therapies that perhaps, let's talk about red light therapy, photobiomodulation. Let's talk about that too, because people need to know, because these are some of the things that they are hearing about, but to hear it from an endocrinologist and why are you using some of these technologies? Let's talk about the why behind introducing some of these in these hubs.
Right. Well, I came across these technologies given my interest to pursue sort of alternative ways of healing. Mm-hmm. And I came across the science of light therapy and quantum medicine.
Yes.
Which we were never taught in medical training and residency. So quantum medicine is a fascinating field, and there are a lot of interesting technologies out there that can detect and treat various illnesses through quantum-based technologies. From the light therapy perspective, it's a field known as photobiomodulation, and using different light frequencies and colors to treat various diseases centered around enhancing the mitochondria in fighting disease, the mitochondria being the powerhouse of the cell.
You bet.
And so you can get local light therapy or whole body light therapy. You can get intra-articular or intravenous light therapy as an adjuvant therapy to the various other treatment modalities that are out there. It's a safe form of alternative care. And it exists throughout the world. Now, if you look at different parts of the world, including Germany and Japan and the Middle East, there's a wider acceptance of these alternative and regenerative therapies than here in sort of a more regulated environment. There's also the field of exosomes and stem cells and engineered cells and natural killer cells and gene therapies and sort of so many other innovative techniques that are being introduced in this rapidly evolving field of longevity biotechnology that I think we need to pay close attention to, because it has the potential to not only disrupt but potentially treat and reverse illnesses. We're excited for the amount of money that's being poured into these industries. Looking forward to the data. Looking forward to the AI-powered drug discoveries and the AI-powered algorithms that will bring us more excitement to the field of therapeutics. And I think over time we're going to see a beautiful continuum merging the proactive longevity innovation with our traditional healthcare model, all set for disruption to help empower our customers, consumers, and clients in living a healthier life.
To become the CEO of their health. And with that, what a conversation. I am so honored to learn from you. I'm honored to collaborate with you. And for those of you that are at home, Dr. Hannah, please share this podcast if you're a healthcare professional, share it with your colleagues. The more conversations that we have like this, the more disruptive we can be in a positive and empowering way for change and advocacy. And that's what preventative health awareness movement is all about. I am so excited that you've agreed to be part of our CEO of Your Health Hub. We'll be doing more work with Dr. Hannah, and stay tuned because we will have him back here on the show. Thank you for your time and energy today and for coming in studio with us. I know how busy you are, and what an honor. I am so privileged to learn from you today.
It's my pleasure, and I'm looking forward to working with you and to help empower the Canadian population with innovative tools and technologies so they can be the CEO of their health and live a longer, healthier life. Focusing on Healthspan.
On Healthspan, and we are going beyond the walls and the borders of Canada, because we now also have Dr. Sinacropi in the U.S. leading the charge for FAM in the United States, and a big announcement with that is coming soon. And of course, we've got a documentary series on preventative health awareness movement coming, so you're going to see more of Dr. Hannah. So for all of you at home, continue to share, and remember this: a healthy tomorrow begins with prevention today. What are you doing to become the CEO of your health? Stay well.